Okay, well, just want to let you know, as I shared with you, that we're going to go over chapters 7 and 8 on alcohol, heroin, and other opiates. I like to start out just so everybody knows where we're going here, and I try to refer back to the learning objectives for the syllabus, and with a specific emphasis on what we're talking about in these two chapters. So looking back at the syllabus and our chapters on alcohol, heroin, and other opiates, that this lecture will be to help you understand basic facts about these drugs. Not everything, but just some basic facts. Become familiar with the elements that constitutes a comprehensive assessment for substance use disorders as they pertain to these drugs. So I want you to have an understanding about how some of these things, how some of these signs and symptoms may express themselves if somebody's experiencing abuse or addiction to alcohol, heroin, or other opiates, so that, you know, if you have a client with this kind of condition, you can be able to make an assessment. And learn how to apply substance use diagnostic criteria with clients using these drugs. And so one of the handouts that I gave you before and that I put in the, on Blackboard was, again, the multi-axial diagnosis form, as well as the GAF scales. And what I also want to bring to your attention about, which I didn't scan and download, but which Dr. Watson shared with you before, and so hopefully you have this. I hope you all have this. It's a diagnostic authority statement. And so I want you to also focus on that, because this class is particularly about assessment and diagnosis of substance abuse. That's what it looks like. It says diagnostic authority statement that Dr. Watson passed out. And basically it focuses, and you're going to break into small groups, so hopefully, can you raise your hand if you have it? No, it was something that Dr. Watson passed out in class.
Passed out the first day of class.
First day of class.
First day. I should have that.
Yep.
I was here.
So what I want you to particularly focus on when you're making an assessment, because you want to work within the scope of your training, you want to focus in just on diagnosed substance-related disorders and the Axis 1. And I kind of mentioned that in the Blackboard announcement that I shared, that you don't want to focus on other mental or emotional disorders, even if in the role play, you know, somebody says, you know, something like, you know, I have a big pet rabbit, he's sitting right in the chair next to me. That's not your scope. See what I'm saying? You don't want to focus on that. You want to focus on what your scope is. There are some things that you can put in a diagnosis as far as Axis 2, but not particularly in relationship to personality disorders or mental retardation. And a lot of the information that Dr. Watson shared with you in terms of elements that you want to look for that I put on Blackboard, those are some things that are going to be really helpful when you're looking at the Axis 3. I'm not going to talk about that anymore, but what I will do, do you have one? What I will do, can I give this to you and then you just kind of pass it around and get a chance for everybody to eyeball it? If you want to make some notes, feel free, but don't anybody hold on to it, huh?
Is it still on Blackboard?
It wasn't ever on Blackboard. He passed it out the first day of class. So just kind of eyeball that, pass it around so everybody gets it and has an idea about that. All righty. So first of all, we're going to talk about chapter 7, which is on alcohol. As we all know, yes?
Just one quick question. You said, like, if the person is seeing a rabbit that's in the chair next to them, where would you actually jot this down? Because that is something, I mean,
Very
you're
good
not
question.
diagnosing it, but it's something that somebody needs to be aware of.
Very good question.
I think you would write that down when you're taking their mental health, doing the mental health piece. Is they're having visual hallucinations or
Appears to,
yeah.
because we don't know. Always say appears to.
Right.
Well, the thing is that you may, in your summary, you may say that this is what client reported. Sam reported he saw, he was talking to a big pink rabbit sitting next to him. Yes.
I think an important part of that is that you don't draw any conclusion about it.
Yes.
Right.
Yeah, he just,
Say that
that's what he
that
said.
happened.
Yeah.
You acknowledge that the client.
Well, it suffers from hallucinations, it could be this or that.
No, you don't want to say it's a hallucination or not because you don't have, you're not.
Well, yeah, no,
Yeah.
that's what I'm saying.
Yeah, right.
Just might not see that bunny.
Right, that's what he said. Just thought I'd mention it. As this goes down the pipe to a mental health practitioner, they might want to take note of that.